Hi, it's Dr. Artis again. I got another help tip for you today. Today we're going to talk about, do you need to switch up your footwear or do you need orthotics? And I want to tell you about that. There's when you look at the feet, if you look at my last post, I talked about strengthening the muscles in the feet. One of the things that happens over the course of time is that the ligaments and the muscles in our feet become weak, either because of just overuse, weight gain, weight loss, or just damage it from different things of spraining ankles or toes and all those different things. And what happens is the ligaments in the feet become weak. Ligaments are like plastic. So once you stretch them out from their original shape, they never go back to the same. And when that happens, that can cause the bones in the feet to drop. When that causes the bones in the feet to drop, you can either overpronate or you can supinate. So overpronate is when you when the ankles start to go in and the feet become flat. When you supinate, that means the arches are usually high. But what you want is a nice neutral balance of the foot. And what happens with that is that allows the foundation to be solid. If the foundation is off, it's going to throw everything else off in the body, right? And so what happens is if I overpronate, that means that my ankles are rolling in. The way that you could do it is if you stand barefooted on the ground and you just look at your feet, and if you see your ankles roll in like this, that means that you're overpronating. When you're overpronating, that can cause a lot of pressure to be put on your ankles and a lot of pressure being put on your knees. That can cause the knees to start to cave in. That can also put pressure on the hip and the low back, just from having the foundation wrong. Just like if you build a house on a bad foundation, it's not going to be solid. Same thing with our bodies. If our foundation is off, our bodies are going to be off because everything is going to be out of whack. That can throw your posture off. That can call your hips off. Everything. And so what happens is it tends to put a lot of pressure on our knees. Now, one of the answers, the way that you can solve that is number one, which I talked about in that last video, is walking barefoot to strengthen the muscles in the feet. You can also do towel exercise where you try to take a towel, put it on the ground, or a t-shirt and pick it up with your toes to strengthen the muscles in the bottom of your feet. There's also different things you can do that we do here in the office. But one of the most common things that a lot of people don't think about doing is going and get properly fitted for orthotics. Now, I'm not talking about going to Walmart and standing on a machine or somewhere and just getting a generalized one. You got to get something that's going to be custom to your feet. And the way that we do it in the office, we take an impression when you don't have any pressure on your feet to get that neutral balance when it's actually sitting with no pressure. So when you stand, everything starts to fall down. And so once you get that, we actually order those and they come in and they support the muscles in the bottom of the feet. One of the other things that you could do too is you can go and get fitted for proper footwear. I always tell my patients there's 3 different types of shoes that we need to look for. Number one, if you don't have any problems, you can wear what we call minimal shoes. Minimal shoes are shoes with the minimum amount of support. That means that they don't have a lot of support. Those are shoes that most of the time people wear. They look cute, stuff like that, or they're not really a lot of support. You're more wearing for fashion. Now, there's also what we call now they do have some minimal shoes that you can wear that actually are performance shoes as well, but those are designed for people that don't have any knee or foot problems or ankle or hip problems. Now, the other types of shoes there are neutral shoes. Neutral shoes are going to be a balance between minimal and stability. Neutral shoes are going to be just something that's going to have equal support on both sides, that's not going to push the arches up or down. And then you also have the last type of shoe that I'm talking about, is stability shoe. Stability shoe is where they're actually going to have like a block in it to actually strengthen the inside of the shoe to keep the foot from collapsing in. Usually you get fitted with these 3 types of shoes at a running store to where you get properly fitted. What they're going to do is they're going to watch you walk barefooted, and they're going to do a test where you stand flat-footed, just stand barefooted on the floor flat, and you can actually see if those arches fall or in. Some instances where people's feet are really bad, they might need orthotics and a stability shoe. But sometimes you can get stability shoes and you don't need it because you don't have enough pronation. You might need a neutral shoe. That's why it's always good to consult with a professional to find out exactly what you need. And that's one of the things that can help you along your journey to strengthen and make sure those hips are straight, make sure those knees are in balance. Because whenever that pronation happens, that can cause that tibia to twist, and that tibia can twist so the knees don't line up like they should. They twist a little bit. That can put pressure on the meniscus and a lot of ligaments inside of the knee, and that can cause a lot of knee problems. That could be stemming from your feet. And a lot of times when you go to any kind of doctors outside of what I do, they're going to focus on the problem and not what caused the problem. And that's what things about chiropractic do, is the basis of what we do is we focus on what caused that problem. So the question you might ask is, am I having foot pain? Can I walk for a certain amount of time without having any discomfort or pain? Or if I don't have any pain at all, I just want to make sure that my body's in good standing, go out, find a good principal corrective care chiropractor and get checked out. Make sure that they're actually looking at that. They're paying attention and answering a lot of these things. Talk about, if you want to run a marathon, is my body in the right shape? Do I have the right shoes? One of the things that I see is people make a lot of mistakes is they go out to the gym and they wear their everyday shoes to work out at the gym. That's a no-no. You want shoes designed for that specific activity of what you're trying to do. So if you're going to run a marathon, you need to get running shoes. You don't want to go out there and try to run a marathon or a 5K with some Air Force Ones on or some Jordans. Those are basketball shoes that are designed for lateral motion, not for just running and impound and the cushion on the back to absorb some of the shock to the body. So one of the things you want to look at too is you want to make sure that you actually have the right type of shoes for whatever activity you're doing. If not, you need to go get fitted. You need to go get checked to get the bottom of the feet. Make sure the body's in alignment. The body works very similar to a car. If you got a nice car and if it's out of alignment and you drove somewhere and the wheel is like this, that car is not going to last very long. Our bodies are the same way. So if we're walking and one hip is shifted to the side or one shoulder's up like that, it's not going to be right. And that simply starts at your feet in the foundation. So if you take this heed, apply it to your life, this will help you. I'm sure it will. I'll see you on the next video.